All the reporting we've been doing on the coronavirus, lung health is getting quite a bit of attention these days. One habit that compromises lung health is vaping. In today's report on the dangers of vaping, Channel 3's Caitlin Francis gets insight into why that's the case.
The Dangers of Vaping is brought to you by Yukon Health.
This is Logan Cron. The Wisconsin teen shared these pictures with the world late last year to show how his vaping habit nearly killed him. Hospitalized with a case of chemical pneumonia directly linked to vaping, he suffered damage to his lungs that he'll be dealing with for the rest of his life. While Logan survived, other users of vaping products have not. The Centers for Disease Control reports 68 people across the country have died as a result of vaping. That number includes one death right here in Connecticut. And look at these statistics. Over a period of just 3 months last year, 34 Connecticut residents suffered lung injuries linked to vaping. Of those cases, 22 patients were under the age of 34.
Clean air should go into a person's lungs. Nothing else should go into a person's lungs.
Will Cox is a specialist in pulmonary medicine at Yukon Health. For years, she's been treating patients with smoking-related lung issues. She's concerned that vape or e-cigarette use by our youth is undermining the gains made from years of stop smoking campaigns.
What scares me the most about this generation in vaping is that they will switch over to combustible tobacco, and that all of the gains that were made with getting kids to not start smoking will be lost.
The nicotine in traditional cigarettes is extremely addicting. When nicotine levels drop in those who smoke or vape, the cravings kick in.
And that often brings them back to then dose themselves again with nicotine, whether it be with a cigarette or an electronic cigarette.
And let's be clear, e-cigarettes contain nicotine. They also contain other things that are dangerous to the lungs.
So besides nicotine, which is included in all vaping products, which makes people addicted to the product, there is also propylene glycol. It's in antifreeze and in paint solvents.
Also in e-cigarettes, cancer-causing chemicals, heavy metals, and some of the vape flavorings, which are especially enticing to younger users, contain a chemical called diacetyl, which according to the CDC is linked to serious lung disease. These ingredients can lead to inflammation in the lungs and trachea, which can impact breathing. More seriously, there is concern that they can lead to scarring of the lungs, which has serious implications.
So scarring of the lungs is going to make a person feel short of breath doing activities, maybe even everyday activities. And that's going to really limit both their ability to lead productive lives and happy lives.
Over the last 6 months, state and federal laws have been enacted to help prevent these issues by making it illegal to buy tobacco or vaping products if you're under the age of 21. And efforts to completely ban flavored tobacco products are moving forward on the federal level. I'm Caitlin Francis, Channel 3 Eyewitness News.